I think that the consumer can feel confident that when they come into a hospital, people are looking out for their safety.
Patient safety has been a priority for hospitals for many years.
Because we want to provide the best, safest care for our patients and families and promote the best outcomes for our patients and families.
Healthcare is a dynamic and innovative field. With ongoing advancements in medicine and a diligent focus on quality, Colorado hospitals continually strive to offer the best possible care for their patients. One critical component of that is patient safety. From the time patients arrive at the hospital until they leave, multiple systems are in place to reduce medication errors, prevent infection, and decrease their chance of being readmitted to the hospital. But it's not just what hospitals do to keep patients safe that matters. Patient safety is a team effort. Hospitals depend on outside healthcare providers, as well as patients and their family members, to make treatment as safe and successful as possible.
In the last few years, the culture in hospitals have changed dramatically. We assume patients will ask the kinds of questions, that they view themselves as being partners with the physician or with the nurse, so they're together looking at it. We would like them to take an active role in their care.
Here are a few key ways in which Colorado hospitals are striving to improve patient safety and how patients and their families can help in that effort. The goal is simple: to make the patient's overall hospital experience even better.
You know, I think that medications are one of the most confusing things for patients today because they take so many. And my experience as a physician is that sometimes patients don't even know the doses of what they're taking and the names of what they're taking. And that's why there's been a big movement to have a patient always have a list of every medication they're taking and the dose.
So when you come into the hospital, bring your medication list. It can be even something that you handwrite yourself. Include your pharmacy name and number, the name of the medication, dose, strength, how you're taking it, once, twice a day, or however, and any specific instructions that you may have to go along with that medication.
If you have a list, please bring it with you. If you don't have a list and you can't remember everything, but you've got all your medicines, bring it with you in a bag. We want to be able to sit down with you and go through all the medications to make sure that we're not missing anything while you're in the hospital.
At each transition in a patient's care, hospital staff members carefully track changes in medication and alert new doctors and nurses to any differences. Yet despite these measures, hospitals encourage patients and their families to ask questions about the medications being given in the hospital.
Medications sometimes conflict with each other. And the only way we know if you're in that situation where you're taking medicines that shouldn't be taken together is if we know what you're taking.
Hospitals work hard to ensure that everyone in the hospital, from direct care providers to housekeeping staff, utilize the methods and tools needed to prevent the spread of infection. From safely delivering antibiotics to wearing protective clothing to something as simple as proper hand washing, hospitals strive to prevent patients and caregivers from contracting or transmitting an infection.
We know that hand hygiene is the #1 area where we can stop the spread of infection.
I probably wash my hands 100 times a day in 8 hours, truly. And they're constantly seeing me, you know, when I come in, when I go out, when I touch anything, constantly washing my hands.
Patients, family members, and other visitors should also be conscious of washing their own hands and using hand gels to prevent the spread of infection.
We want to make sure that you yourself know what you can do to help stop the spread of an infection. If you didn't see your healthcare professional walk in the room and wash their hands, we want to make sure that you are not afraid to say, "Stop and wash your hands."
Doctors and nurses closely monitor each patient's condition during their hospital stay. Yet, if a patient's condition begins to worsen, hospitals have improved procedures in place that allow them to respond more quickly than ever.
Can you call a rapid response room 619?
Because family members often know patients best, they can also help by notifying a nurse or doctor when something appears to be wrong. Called rapid response teams, these are groups of specially trained healthcare providers who can arrive at the bedside within minutes to assess the patient and offer timely, life-saving care. Today, many hospitals encourage anyone who notices a decline in a patient's condition to speak up and activate the rapid response team.
Having a rapid response team in place really allows the staff to escalate their concerns to the next level of care, and in most cases that's the ICU team. A rapid response team improves our safety net for families and patients, and ultimately the safe and high quality care that we give our patients.
During their stay, and especially when leaving the hospital, it's important that patients understand the steps they should take to stay healthy. At discharge, a nurse or other care provider will discuss a plan with the patient to ensure they know any special care instructions they must follow upon returning home.
So we believe that from start to finish, if we can admit you into the hospital, take care of you and do the best we can do, and send you home with greater knowledge than when you even came in about your incision site, your home care, your dressing care, your antibiotic care, all of those things, we know that there will be a better outcome and the less chance of you being readmitted.
Patients should ask questions about anything they don't understand when they're being discharged from the hospital. If they don't feel comfortable asking questions of their doctor or nurse, it's good to have a friend or family member present who can advocate for them and make sure they clearly understand the care instructions.
Sometimes you throw things at people and they nod their head and they say, oh yes, yes, I'll do that. And I think they're just intimidated, they're tired, they want to go home, and they may not have absorbed the information. So somebody who's prudent says, now you tell me what you're going to do when you go home. What did we tell you? And I think that's the time well spent.
If they don't continue to follow the instructions, if they don't continue to take their medications, then a lot of times we have something which is known as a readmission, and that again contributes to more cost in the system.
Preventing hospital readmissions is an important step in keeping patients safe, while also reducing unnecessary costs to the hospital and the overall healthcare system. Lower system costs means more people have access to healthcare.
I think in Colorado there's an amazing commitment to improve performance among all hospitals and physicians and all providers of care. We actually are doing very well. There's always opportunities for improvement.
It is a partnership. We all are fallible. We can make mistakes. That doesn't mean that we shouldn't have a goal of perfect care. And that's what we strive for. And we want our patients and families to help us do that.
So I think we're clearly at that leading edge of embracing patient safety, of putting in place the kinds of checks and balances to make certain the patient has the best experience, but we've got opportunities to do better, and there's a real commitment to improve.
So our goal when somebody is admitted to the hospital is to really get them better and get them discharged back to home as soon and as safely as possible.
This presentation was made possible by the Colorado Trust, a grant-making foundation dedicated to achieving access to health for all Coloradans.